The main symptoms, the initial symptoms, was severe stomach pain, uh, which encouraged the doctors to give me a PSA, which was I think the initial was about 7.5. And then after that, I noticed that there was an increase in urination. In other words, I was having to get up 3 or 4 times a night. I wasn't able to drive sometimes for more than a few hours without having to stop at a gas station or something and go to the restroom. People who have prostate cancer often urinate frequently. In fact, I would go to a concert or something and I'd have to get up in the middle of the concert and go to the restroom. So I went to see another urologist, and he gave me another biopsy, and then they found that I did have cancer. And the biopsy revealed that I had a Gleason scale of 9, which is very high. The Gleason scale refers to the concentration of cancer cells, and generally on a scale from, say, 1 to 10. So 9 is treacherous. So naturally, this caused some worry in me, and he recommended immediate surgery. I, on the other hand, was averse to surgery, but I didn't at that time see any alternative. Then, as luck would have it, I found somebody just casually mentioned to me that somebody was using an alternative procedure and that I should contact him. So I did. And it turned out that he was using the Beck procedure. And of course, this was very new to me, and I saw him. In fact, I met him at the door, and he had a unit similar to this on his arm. So I asked him about it, and he said, well, it's helped me immensely. I canceled my appointment for surgery and bought a Beck unit from Soda. And then I did try it, and at first I had an initial reaction. It wasn't a serious negative reaction, but I found that I couldn't sleep too well the first night. So I got a little discouraged, and I said, well, I think that I'm going to lay off this for a while. But I had heard about one other medication, vitamin, that is supposed to be an anti-cancer vitamin. So I made a call to this health store, and this person answered the phone who seemed to know a great deal. Rick answered the phone, and he seemed to know a great deal about the Beck procedure. And I told him that I was using the Beck. He says, get back on the Beck. He says, this vitamin or this procedure you're asking for is not a good one. So he said, I know Dr. Beck personally. He's a wonderful man. And he said, you just had a minor reaction. He said, get back on it and you'll be fine. So I did. And everything was fine from then on. And I started with the Beck with maybe an hour at a time, and then 2 hours, and I eventually got up to 6 hours. I kept on the Beck for about, on the silver pulsar, for about, I think, 6 weeks. Then I went back for another blood test, and this is what is important. And my blood was wonderful. I mean, really, it was amazing. The red cells were nice and round, and there was some activity in the white cells. So I kept on the Beck for at least the next year or two, and I remember I was so dedicated to it that I broke my arm. I fell, and even I was in the hospital bed. I insisted on having the Beck unit right by my bed so that I could put it on, because I was determined that I was going to use it every day. And also I found the magnetic pulsar was very useful to me. I not only would use it on various parts of my internal organs by pressing it on the kidneys and liver and so forth, but I used it directly on the prostate for a period of 5 minutes sometimes. I knew that it penetrates, as I understand, at least 9 inches into your body with microcurrents, and so I used this in conjunction, and sometimes at the same time with the pulsar. And I think that and I'm sure that it must have helped. I don't get up in the evening at all, at night, and I feel much better. I feel great. So it's, you know, it's very subtle to know what influences have created a healthy environment for you, but for your body. But I feel that the Beck unit certainly has been very, very important in my health, overall health. One of the I think significant factors in my health today is my attitude toward my body in relationship to my spirit. In other words, I feel that my spirit, my higher self, call it whatever you will, is the determiner of ultimately the ultimate determiner of my health. And I've always had a very strong feeling that that one should think positively about one's health. And I have a great reliance upon God, that God will see me through any threat to my health. I meditate regularly, and I read spiritual literature on a regular basis, and I try to see my body as a vehicle of my spirit. And so, in other words, this spirit inside of me is what is going to keep my body healthy. I owe a great debt of gratitude to Dr. Beck, and to his courage and his genius in developing this procedure. And I feel grateful because of this procedure, because I could have died.